Just published August 11th, 2026, the American Society for Radiation Oncology's newest guideline on radiation therapy for pancreatic cancer. The purpose of this guideline is to provide evidence-based recommendations on the use of radiation therapy, or RT, for the treatment of pancreatic cancer in a variety of clinical settings, including patients with resectable, borderline resectable, locally advanced, metastatic, and symptomatic disease. In today's rapid update, we'll just be going over a summary of recommendations. So for the full guideline and recommendations, make sure to check it out on guidelinescentral.com. Let's get started. Starting with the section on indications for RT and sequencing with systemic therapy and resection. For patients with resectable pancreatic cancer receiving preoperative therapy, preoperative chemoradiation is conditionally recommended. For patients with resectable pancreatic cancer and pathologically uninvolved lymph nodes who did not receive preoperative chemoradiation or RT, postoperative chemoradiation after multi-agent chemotherapy is conditionally recommended. For patients with borderline resectable pancreatic cancer, preoperative chemoradiation or RT is recommended. For patients with locally advanced pancreatic cancer, chemoradiation or RT after multi-agent chemotherapy is recommended. For patients with medically inoperable pancreatic cancer or who are fit and decline surgery, chemoradiation or RT following multi-agent chemotherapy is recommended. For patients with non-metastatic pancreatic cancer receiving preoperative chemoradiation or RT, surgery is recommended to occur 4 to 8 weeks after RT. For patients with non-metastatic pancreatic cancer receiving chemoradiation, concurrent single-agent chemotherapy is recommended. Next, the section on appropriate dose fractionation, regimens, and target volumes. For patients with resectable pancreatic cancer receiving preoperative chemoradiation, moderate hypofractionation is conditionally recommended. For patients with resectable pancreatic cancer receiving postoperative chemoradiation, conventional fractionation is recommended. For patients with borderline resectable pancreatic cancer receiving preoperative chemoradiation, the following options are recommended. Conventional fractionation, 5,000 to 5,400 centigrade in 25 to 30 fractions. Moderate hypofractionation, 3,600 centigrade in 15 fractions. For patients with borderline resectable pancreatic cancer receiving preoperative RT, stereotactic body radiation therapy or SBRT is conditionally recommended. For patients with locally advanced pancreatic cancer receiving chemoradiation or RT without dose escalation, the following options are recommended. Conventional fractionation, 5,000 to 5,400 centigrade in 25 to 30 fractions. SBRT, 3,300 to 4,000 centigrade in 5 fractions. For patients with locally advanced pancreatic cancer receiving chemoradiation or RT with dose escalation, the following options are recommended. Moderate hypofractionation, 6,750 centigrade in 15 fractions or 7,500 centigrade in 25 fractions. SBRT, greater than 4,000 to 5,000 centigrade in 5 fractions. For patients with non-metastatic pancreatic cancer receiving RT with preoperative or definitive intent, elective targeting of high-risk sites for microscopic disease is recommended. For patients with non-metastatic pancreatic cancer receiving RT, the following options are recommended for elective target volume dosing. Conventional fractionation, 4,500 to 5,040 centigrade in 25 to 28 fractions. Moderate hypofractionation, 3,600 to 3,750 centigrade in 15 fractions or 4,500 to 5,000 centigrade in 25 fractions. SBRT, 2,500 to 3,300 centigrade in 5 fractions. Then the section on preferred treatment planning and delivery techniques. For patients with non-metastatic pancreatic cancer receiving chemoradiation or RT, intensity modulated radiation therapy is recommended over 3D conformal radiation therapy. For patients with non-metastatic pancreatic cancer receiving chemoradiation or RT, a patient-specific respiratory motion assessment is recommended. For patients with non-metastatic pancreatic cancer receiving chemoradiation or RT, respiratory motion management is conditionally recommended. For patients with non-metastatic pancreatic cancer receiving chemoradiation or RT, fasting for at least 2 hours before stimulation and treatment is recommended. For patients with non-metastatic pancreatic cancer treated with chemoradiation or RT, IV contrast at simulation is recommended unless there is a contraindication to IV contrast. For patients with non-metastatic pancreatic cancer receiving dose-escalated, moderately hypofractionated chemoradiation or SBRT, fiducial markers are conditionally recommended. For patients with non-metastatic pancreatic cancer receiving chemoradiation or RT, daily image guidance is recommended. For patients with pancreatic cancer, adaptive RT is recommended for dose-escalated SBRT to maintain safe OAR doses and optimize target coverage. And last, the section on indications for RT in the setting of recurrence, reirradiation, metastatic disease, and/or palliation for patients with pancreatic cancer and isolated local regional recurrence after surgery and no prior RT, definitive intent chemoradiation or RT with or without induction and/or consolidation chemotherapy is recommended. For patients with pancreatic cancer and isolated local regional recurrence after prior RT, reirradiation with or without induction and/or consolidation chemotherapy is conditionally recommended. For patients with oligometastatic pancreatic cancer, definitive intent chemoradiation or RT is conditionally recommended to the metastatic lesions and primary tumor as part of the multidisciplinary discussion. For patients with oligoprogressive pancreatic cancer, definitive intent chemoradiation or RT is conditionally recommended to the metastatic lesions and primary tumor as part of a multidisciplinary discussion. For patients with pancreatic cancer-related symptoms, RT for palliation is recommended. And there you have it. Make sure to check out the full guideline from the American Society for Radiation Oncology and other related clinical decision support tools at guidelinecentral.com.